Hi guys, I'm Dr. Jill, and today I am talking to you about peptide therapy. I've been getting a million questions about this. Peptides are one of my favorite tools to use with my patients and their hormone optimization, age management needs. So what is a peptide? A peptide is a chain of amino acids that occurs naturally in the body, but there are specialty compounding pharmacies that can manufacture these so that we can have different formulations accessible to us to boost our own. So what does that mean? And what do they do? What do the peptides address? There's so many different uses for peptides, and you can actually target the uses based on your symptoms. And it's not just for symptom relief. The peptides actually are helping to reduce your risk for age management, age-related diseases like dementia and Alzheimer's, inflammation, which is at the base of so many different diseases, heart disease, depression, cancer. So there's a ton of different peptides available. I'm only going to be able to address a few of them today. This is going to be the first of a series discussing peptides and the many benefits. There's not a lot known about them just because they are not FDA approved, which is not necessarily a bad thing. You can't actually patent something that occurs naturally in nature. So there are plenty of studies though out there showing the safety of them. So these are things that are not taught in traditional medical school. So your regular doctor is most likely not going to know about them. So if you ask them about them, most people will say, well, either I don't know, or if there's not enough data. And it's not that there's not data, it's not, they're not backed by big pharma, so there's not a lot of money in it, so there's not a lot of publicity about it. But there's plenty of data showing the safety of peptides and the many benefits. So what are peptides used for? Again, it is, they can be targeted for specific symptoms, and again, they are helping with not only with the symptoms, but they're reducing your risk of many other issues. So peptides can be used for people that have low energy or fatigue, people that are wanting to lose weight or build muscle gain, people that are having trouble with insomnia or falling asleep, people that are just not feeling themselves or feeling off. They can be used for inflammation. That's one of the key ones that I'm going to talk about today. Generalized inflammation, localized inflammation from an injury, gut inflammation, so much more. They can be used for mental clarity and focus, so ADHD type symptoms. They can also be used for erectile function or sexual function in men and women. It can be used for hair growth, nail growth, for improved collagen production. There are peptides specific for boosting your immune system, so people with autoimmune diseases. So many different options. And like I said, I'm just going to touch on a couple today that I absolutely love for my patients and for myself. And this will be the first in a series that I'll be talking about because I've gotten so many questions about peptides. So one of the ones that I love to use that I get phenomenal results with is BPC 157, Body Protection Compound 157. And that one is targeted for inflammation. And again, that's for systemic inflammation, localized inflammation. So I have used this personally. It, boosts your recovery. So when you work out, you're not as sore afterwards. I've also had an injury where if you inject directly into those areas, you get rapid healing. I've had patients that, I had one man, he was 52 or 53, and he was scheduled to have another hip replacement. He had a congenital hip problem, and he no longer needed surgery. I have a woman who's in her 30s who was scheduled to have a foot surgery for some inflammation from running. And she started on this BPC 157 and canceled her surgery and is back to running. So it has many uses. Like I said, it can be used to calm gut inflammation, and gut health is so important, especially for brain health. It can be used for people with traumatic brain injury where there's low-grade inflammation, so it can help reduce that. And like I said, for aches and pains, so many different diseases, inflammation is at the base of it. So it's a good one to be on, like, for maintenance. But it's also good for acute injuries as well to really help with that. Because as we age, we start declining, and we start getting these random aches and pains, and that can be a message that your body's sending, like, hey, there's something going on. And usually that's low-grade inflammation, which when your hormones are not optimized, that actually creates an inflammatory state. Yes, it is good for osteoarthritis. Thank you for that question. It works very quickly, usually within 1 to 2 days. It's an injection, a subcutaneous injection, so it's not a large needle. It's very safe and is amazing. Another one that I love to use is C-Max. It comes in a nasal spray and an injectable. C-Max is for cognitive function. It actually helps with energy, with mental clarity, with focus. I've had several patients that were diagnosed with ADHD or have ADHD type symptoms. They can't focus, they have brain fog, and they're on Adderall, and they need Adderall every day to function. And so I've been able to actually get them off of that, because Adderall is actually, it's a stimulant, it's highly controlled, and it really is just providing symptomatic relief. It's not really doing anything beneficial. I always look for, how many birds can I kill with one stone? With C-Max, you actually not only get the improved mental clarity and focus and cognition, but it reduces your risk for dementia and Alzheimer's disease. And there's 2 different ways that it actually works, and part of it is not completely known, but one of it is with the nitrous oxide receptor, so it's actually enhancing blood flow to the brain, but it also stimulates BDNF, which is brain-derived neurotrophic factor, which this is what causes neuroplasticity. This is actually the same particle that is activated with ketamine and with several of the other psychedelic medicines, or plant medicines, that causes neuroplasticity. So what does that mean? That actually means that you can grow your brain, you can grow your brain cells, and you can grow your neural connections. So people who have had abuse, brain damage from abuse, you can actually recover from that. Brain damage from traumatic brain injury, and also just from aging. We start losing, our cognition from the hormonal decline, and this is something that creates those new neural connections. So you actually can enhance not only, like I said, your mental clarity, but your creativity. And you can learn new things. You can start doing new things. So I love this product. It actually works phenomenal within the first use of it. And again, I always look at not only symptom relief, but what can I prevent? So preventing dementia and Alzheimer's disease is amazing, and it works very quickly. And that's called C-Max. And I'll type a little bit later so you can look these up as well. Super safe. Some of the other ones that I love to use, PT-141, that is used for sexual function in men and for women, and it actually works on the neural pathway. So most medications that are used for sexual function, like Viagra, Cialis, which women can use as well, work on the vascular component, and the PT-141 works on the neural pathway. And this can be used for men and for women. It helps with erectile function. So if you've tried those other products, the Viagra, Cialis, and you're not getting the results that you want or desire, it could be that it's not necessarily a vascular issue, but it could be like the neural pathway. And so that again works very, very well. And that comes in a nasal spray as well as a injectable, and this is available for women as well to help with their sexual function and their orgasms as well, because we need orgasms. Everybody does. And speaking of orgasms, when we have an orgasm, we release oxytocin, and that's a hormone that occurs in men and in women. And that's also, it's not a peptide, it's a hormone, but it's something that I use for men and for women. And this helps with heart opening. It actually helps relieve social anxiety. It helps for men and women who are having difficulty achieving orgasms, and it helps with creativity. And it also has a nootropic effect. And nootropics, what is that? That is like brain opening neuroplasticity that I was talking about with the CMAX. There's several different options with that. That's a whole separate topic. And then as far as like other things that peptides can be helpful for, like I said, the energy, the fat loss, the muscle gain, sexual function, erectile function, mental clarity, focus, sleep. Sleep is huge. As we age, our sleep starts to change, and it can be, having difficulty falling asleep, staying asleep. And there are different peptides available for that as well. One in particular that I use in my clients and with myself is CJC with ipamorelin. The combination seems to work really well, and that helps to get you into that deeper sleep where you're stimulating your own IGF-1 production, which is how we measure growth hormone. So what do we do before peptides? The only thing that we really had was HGH, which a lot of people know about. And that was fine, but these are more natural because they're helping your body produce its own production of IGF-1, like I said, the way we measure growth hormone. But it's not only that, they're actually pleiotropic. So they stimulate that, and they have multiple other functions like stimulating collagen production. They promote just overall well-being, and they help with glucose control, insulin control, blood pressure control. So again, not just symptom relief, but actually helping to reduce risk of age-related diseases. Again, there's a peptide for hair growth and for collagen production that helps with your own natural production. And yes, so as far as the question, can you take multiple peptides? Yes. And it's nice because some of the peptides do hit a couple of the same, can kill a couple birds with one stone, but it's usually targeted for specific results. So usually you have to use a couple different ones. So if you are needing sleep and you're needing the mental clarity and you're having the inflammation, they all work well together. But they have separate functions. And then the really important part is where you get your peptides from. A lot of people go online and they try and order from wherever, and the safety isn't really known from some of those people. So where I source my peptides from are compounding pharmacies that are endorsed by the International Peptide Society, which is, I am trained and certified in peptide administration. So it's really important that you have a practitioner that is actually trained and certified in peptide management, not just, dabble here, dabble there. It's really important that your practitioner, knows where their products are coming from, have used them themselves to be able to speak from experience, and are using quality sources, because quality does make a huge difference. Some people that come to me, having seen an age management physician and said, I was taking these, medications, these hormones or these peptides, and it didn't really make a difference. Even supplements, quality matters. And so I use specific compounding pharmacies that I've used for years because I know their quality is amazing. And with any type of age management, hormone optimization, you should feel and see a difference within the first week to 2 weeks. This is not a wait 6 months and see. If you're not, then you're not at the proper dose, the quality may not be there, and your practitioner may be using suboptimal dosing. I am trained very extensively with aggressive dosing that is evidence-based to be safe and effective, which is super, super important. So please leave your questions in the chat. Like I said, this is going to be a series that I'm going to be talking about. You can DM me for more information. There are more peptides that I'm going to be talking about, but I just wanted to hop on here because I've been getting so many questions about peptides, and I wanted to answer as many as I could right here. Feel free to share with your friends that are interested in this as well. People can check me out on my website, www.drjillstalker.com. And again, this is cutting edge therapy that is absolutely amazing. It's been around for years. There's just not a lot of awareness around it. So I wanted to bring that to the forefront. So I hope you guys have an amazing day, and I look forward to answering your questions.